Good afternoon. My name is Kimberly Fowler, and I am the Director of Technical Assistance and Research here at the National Council of Urban Indian Health. We welcome you here today for this Enrollment Community of Learning webinar, and I'd like to thank you for joining us for this webinar entitled Economic Security, Connecting Native Elders with Benefits Program. I ask that if you haven't already done so, please provide your name and organization in the chat box located in the lower left-hand side of the screen. All lines are currently muted. However, if you do wish to ask a question, we ask that you write them into the Q&A pod at the lower right side of your screen. We'll definitely provide time for your questions to be answered at the end of the presentation, but you are able to write these questions at any time throughout this presentation. This community of learning is specifically geared towards benefits specialists, assisters, and navigators that are working on the ground in urban Indian communities to reach the uninsured, as well as open to all those that have an interest. By providing you with relevant information and practical tips, NCOA aims to support you in being successful in your outreach activities. Today's Enrollment Community of Learning will feature a presentation from partners at the National Council on Aging, who will be sharing with us information on NCOA's benefits enrollment centers that can assist you in helping your seniors and elders. Brandy Barr is the Communications Manager, Economic Security at the National Council on Aging, where she works with community organizations and state agencies across the country to promote benefits for older adults, identify strategies to improve the financial security of vulnerable seniors, and disseminate promising approaches to maximizing benefits outreach and enrollment. Co-presenting with Brandy will be Randy Feliciano, who is a program manager with NCOA's Center for Benefits Access. He devotes his time to providing technical support to benefit enrollment centers throughout the United States and spearheading several committees of national, nonprofits, and federal government agencies focused on providing guidance and leadership for low-income Medicare beneficiaries. So with that, without any further delay, I now would like to turn it over to today's presenters, Ms. Fowler and Mr. Feliciano. Just as a reminder, you may post questions at any time in the Q&A pod to be answered at the following of the presentation. You are ready to begin, Brandy.
Thank you, Kimberly, and thank you everyone for taking time out of your schedule to listen to us today. We hope that we provide some useful information and connections that you can make in your community to help Native elders. Before we get started, though, I wanted to do a little poll just to see what kind of your population that you're serving, and this just asks you what percentage of your clients that you're currently serving in your health centers are age 60 and older, just an estimate. Give it a little bit of time here. Oh, it looks like we have a fairly interesting spread across. We've got a few people who have more than 50%. That's really amazing that you're serving that many people. So, and then a lot of you who are dealing with, roughly a quarter. So really, really interesting there. So it looks like a lot of you are serving a lot of older adults, and so that is great. Let me go back. Kimberly, can you take me back to the slides? All right, thank you. Now, a little bit about us before I start talking about some of the benefits that we help to connect seniors to. The National Council on Aging, or NCOA, we turned 65 years old last November, so we're eligible for Medicare as an organization. Actually, we are a national nonprofit service and advocacy organization headquartered in the Metro DC area. And our work targets older adults, but also particularly the organizations that serve them at the state and community levels, especially people who are providing health, financial, and human services. We have a specific mission to improve the health and economic security of older adults, and we define our population as older adults who are age 60 and older, who have one or more chronic conditions and or who have incomes below 250% of the federal poverty level, which in 2016 is roughly $29,000 a year. We have a very special interest in particular among this group of finding better ways to serve what we call isolated populations. And we define those populations as people isolated by either disability, language or culture, or geography. And that's certainly where you guys come in, serving specifically urban Indians. And that would sort of cross our geographical as well as our language and cultural interests. Within NCOA, our work is divided across three main sort of practice areas. We work in economic security, in health issues, and then at a broader public policy and advocacy level. And within our economic security group, we house the National Center for Benefits Access. This center is funded by the U.S. Administration for Community Living within the U.S. Department of Health and Human Services. And we have a goal of helping community-based organizations and state agencies to find and enroll seniors and younger adults with disabilities who would likely qualify for Medicare because of their disability, who have limited income into the benefits programs for which they're eligible. Before I start talking a little bit about some of these benefits programs, I do want to kind of step back and talk a little bit about what the state of elder economic security is in this country. We know that there's a tremendous divide among seniors in this country. You know, you watch TV and you see all these pharmaceutical commercials, and there's this perception that seniors are well off and they're, you know, on their little boats and golfing, and we know that's not the reality on the ground. One of the issues that we're particularly interested in is debt. We know that debt among older adults has grown significantly in the past decade. Medical costs are a huge source of debt for this population, followed by credit cards and household utilities. Medicare households spend on average over $5,000 a year alone in out-of-pocket costs, and certainly that contributes to some of that debt. For senior households that do have debt, that median debt in 2013 was almost $41,000. So they're not just carrying a little bit of debt, they're carrying a lot of debt. We also know that there's roughly 25 million adults age 60 plus who have incomes below that 250% federal poverty level. We sort of chose that as, you know, it wasn't arbitrary. We were looking at that level because you may not be in poverty and you may still be above the threshold for certain public benefits, but you're usually one sort of financial event away from that poverty level, you know, whether it's a health crisis or losing your home or losing your job if you're still working. And sadly, we know that Indian elders have even higher rates of poverty compared to the general senior population, 17.5% versus 9.5%. And on average, they draw less in Social Security each year compared to non-Indian populations, so roughly $1,000 less. And so therefore, you know, benefits sort of come into play here because benefits can really help to put some money back into the pot when we have people dealing with a lot of these issues of poverty and debt. So what do seniors, low-income seniors, need help paying for, and what benefits can help? You know, we sort of sat down and looked at the key areas where older adults need financial assistance, and we identified what we call the 5 core benefits that can help. And so these are related to health care, prescriptions, food, and utilities. And I'm going to go into a lot more detail about these 5 programs. They all have some sort of federal administration component, but a lot of them are administered specifically on the state level. And so before I launch into sort of explaining some of these programs in more detail, I'd like to put in our second poll, which is really asking about the familiarity with these 5 programs. Give it a second here. Kimberly, I'm not seeing the poll coming up.
It's actually being shown right now in broadcast. The poll question says, do you help your clientele with any of these programs? Responses are A, Medicaid, B, Medicare Savings Program, C, Part D Extra Help, D, SNAP, and E, LIHEAP. And it looks like about 50% of our audience selected A, Medicaid.
Yeah, and that doesn't surprise me at all. I would imagine that being Indian Health, that you would have quite a bit of familiarity with Medicaid, maybe a little less with the Medicare program, but that's good and very interesting to know, because I think what I'm going to share with you may be surprising or new, or sort of help to kind of wrap around some of your knowledge about these programs. So for those of you who do work with Medicaid, you may know this already, but there are roughly 9 million people in the U.S. who are eligible to receive both Medicaid and Medicare. And these individuals are sometimes called dual eligibles, or just duals. And the way it works is that when a person has both of those programs, Medicare pays first, and then Medicaid pays for some of the Medicare co-payments and cost sharing. So Medicaid is usually the second payer and kind of the wraparound coverage. So an individual who is a dual who gets those two programs would not need any other sort of supplementary programs, such as a Medigap plan or supplemental insurance, because between the two programs it's pretty comprehensive and it should cover most of their costs. And anybody who gets both of these programs is going to get automatically enrolled into what's called the Part D low-income subsidy, which I'm going to talk about in just a couple of slides. But this is a program that helps people save a significant amount of money on their drug costs. And just a side note here, there is a trend across the country and in a lot of states to enroll this dual eligible population into Medicare Advantage plans, or kind of Medicare HMOs. We're seeing this more and more, and sometimes to some success and sometimes not. So that may be happening in your state, and so just to kind of keep you aware of that being a part of the puzzle. Now, the Medicare savings programs are financed by the state Medicaid agency, but help to pay for the Medicare premiums and cost sharing for people with low income and resources. And these programs are available to people who don't fully qualify for Medicaid. So they don't have incomes low enough to make them a dual eligible population, but they have incomes that are still very low, and they still need help paying for their Medicare costs. And you may have heard of these programs in relation to their different acronyms: QIMBY, SLIMBY, and QI. QIMBY is the most sort of comprehensive and generous of the Medicare savings programs. It covers Medicare premiums, it covers the deductibles, the co-pays, co-insurance, and even in a lot of states, if a person doesn't have the work credits to get Part A for free, it will help pay for that as well. And those premiums could be very expensive for people who don't have that work history. So QIMBY is the most comprehensive. And usually to qualify for QIMBY, you have to have income below 100% of poverty. SLIMBY just covers the Part B premium, which is $121.80 a month for people who qualify for this in 2016. And generally it's people who have incomes between 100 and 120% of poverty. And then QI also only covers the Part B premium, but people can qualify for that with incomes up to 135% of poverty. Now, these thresholds for how to qualify are set at the federal level. However, there's a tremendous amount of flexibility offered to states to play with those. They can't make them more restrictive than the federal guidelines, but they can be more generous. And we do know that in a lot of states, they are more generous. I live in D.C., for example, and they have expanded their QIMBY program to 300% of the poverty level to sort of account for the fact that it's a very expensive city. So a good thing to look at your state Medicaid agency and see what the qualifications are on that. Another really important thing that the Medicare savings programs do is they have no late enrollment penalties. So if you have somebody who didn't sign up for Medicare when they first qualified for it at age 65, and they qualify for these Medicare savings programs, they don't have to pay that late enrollment penalty that some people are subject to. And like Medicaid, anybody who gets a Medicare Savings Program will also automatically get this Part D low-income subsidy and be enrolled in that benefit. And that is true even if you are living in a state with a more generous income threshold. So what is the Part D low-income subsidy? This is a program that is administered by Social Security and Medicare, and it helps to pay for Medicare Part D, or the drug plan. What it does is it pays the Part D plan premium up to a benchmark amount, which is roughly like $33 a month. Usually there's a lot of plans within that benchmark amount in every state and every area that people can choose from. If they choose to enroll in a plan that's above that benchmark, they would just pay that difference in the premium. And more importantly is that when individuals who get this extra help go to the pharmacy, they have the share of what they pay for their drugs is very low. It's usually between $1 and $7, and $7.40 is the maximum for a brand name drug at the pharmacy. So the tremendous amount of savings. And then finally, anybody who gets extra help, which is the name that the Social Security Administration gives for this program, does not ever enter the Part D coverage gap, or the donut hole, which you may know about, which is a certain, it happens once a person spends a certain amount of money on their drugs. Anybody who gets this is never going to hit that coverage gap. And then like the Medicare Savings Programs, there are no late enrollment penalties. And this is very good. We hear a lot of older adults who they age into Medicare. Maybe they sign up for Parts A and B, but they're not taking any drugs at age 65. So they say, why do I need a drug plan? I don't want to pay for that. So they don't enroll. And then they, if they need to enroll, 5 years later when they have some condition, and they don't realize that they're subject to a penalty because they didn't enroll when they first were supposed to. And so what this program does for people who qualify is it also eliminates that late enrollment penalty. And even more importantly, somebody who gets this can switch their drug plan at any time, which is very nice. Most people with Medicare have a certain window every fall, an open enrollment period, to be able to change plans. But anybody who gets extra help can change at any time. Now, you're probably all familiar with this next program by its old name, food stamps, which is now called the SNAP program, Supplemental Nutrition Assistance Program. Although it is called different things in different states, 3 Square in one state, CalFresh in California. It's administered by the USDA, Food and Nutrition Service, and the SNAP provides monthly funds to households on an EBT card, or an electronic benefits transfer card, to spend on food. Now, like Medicaid and the Medicare Savings Program, there's a federal threshold for who can qualify, but because it's locally administered, the eligibility requirements vary widely by state, and quite a few states are more generous. The federal threshold is a household has to have income below 100% of the federal poverty level. However, for people over age 60, which is considered senior by the SNAP program, that 100% is actually their net income, not their gross income. So there are a lot of deductions for older adults and people with disabilities, especially their medical expenses. If you have an older adult who spends more than $35 a month out of pocket, they can deduct that from their gross income and therefore qualify for SNAP, but also qualify to get a higher benefit for SNAP. So that's something to be aware of. And each state varies by what it counts as out-of-pocket medical expenses. Some states will allow, for example, the Part B premium in Medicare to be an out-of-pocket medical expense. It's one of those things you would need to check with your state for the eligibility guidelines for that. And finally, the LIHEAP program, the Low Income Home Energy Assistance Program. This is a program that's administered through the U.S. Administration for Children and Families. And the way this works is it's a block grant to states and territories. Each state gets a certain amount of money based on their sort of population, and once they spend that money for the season, the funds are gone. There isn't any more. So the way it works is the grants are either paid directly to the household or to the energy company. And they can be used for things like attic insulation, heating, cooling, sometimes things like tuning up and replacing heating units or air conditioners, including just paying your utility bills. Most of the funds, because it's a block grant, get expended in the winter because the federal fiscal year starts October 1, and then those block grants go out to the states, and the states have a window of time in which they make them available, and if you don't apply during that window of time, the funds are gone. They're usually administered locally by community action agencies, and to qualify, people must have income below 150% of the federal poverty, though some states have a higher limit if their median income is higher. So what we always say to people, if you know individuals who are having problems paying for their heating and cooling, tell them to look in the fall and apply early, because this is a program that does sort of sell out quickly, as it were. Just wanted to sort of show this slide to you. This is really interesting. We've taken the annual value of these programs, and these value has been calculated at the federal level. So these figures have been provided by the administering agencies. And if somebody were to qualify for all 5 of these programs, it would be a value of nearly $13,000 a year. Now, we know that not everybody is going to get all 5 programs, but even you can see for somebody who gets Medicare Savings Program and the low-income subsidy, that's savings of $5,000 to $6,000 a year. And for somebody who's getting the average Social Security benefit, which is a little over $1,000 a month, that can be a significant increase in their income and freeing up money that they can spend elsewhere in their limited budget. So how can you help people with screening and applying for these programs? I'm going to talk about one of the online tools that we have, and then and a couple of community ways that you can connect in your community before I hand it over to my colleague Randy, who's going to talk specifically about a resource called Benefits Enrollment Centers. So the first tool I want to highlight is something that we developed. It's a free online consumer tool that screens for over 2,000 programs, both public and private, including all of the benefits that I just noted. Basically, it's a questionnaire you can go through. It asks for information about individuals' income, their expenses, what drugs they take, and it issues a personalized report. And that personalized report says, here are the programs that you may be eligible to receive help from. Here is how you apply. If there are applications online, they can connect to that or download the application. It tells you the office where you can apply for a lot of these programs and gives you the map. And so we've had this, like I said, since 2001, and we've helped over 4.5 million people identify over $15 billion worth of benefits. It's a great tool. You can do sort of shortened versions of the questionnaire. There's a long questionnaire, but there's also, like, you can just look for prescription drug help, see if the person qualifies for extra help. So we really encourage you to use that with your clients if you know that, or to refer them to that if they have internet access and they're able to use that. But of course, we realize a lot of older adults don't have internet access, or may not be comfortable using the computer, and that's why we really emphasize the value of getting community assistance wherever possible and one-on-one contact. One of the places that we really encourage people to go to is the State Health Insurance Assistance Program, or SHIP. SHIPs go by different names in each state. They're called HICAPs in some states. They're called SHIBA in other states. But what they are federally funded agencies that provide free and impartial advice about Medicare to people and their families. And one of the key things that SHIPs do is they're also resources that help people apply for the Medicare savings programs and the extra help program. They can do all the application assistance. They can help troubleshoot those applications. The SHIPs are available across the country. They have different local offices. You can find your local office either online at the SHIP TA Center or by calling a centralized call center that will then make that referral for you. Local aging organizations such as Aging and Disability Resource Centers and area agencies on aging also often do this benefits assistance for these core benefit programs. Rather than sending you a million places to find yours, the Elder Care Locator is a tool from the Administration on Aging that has it all sort of centralized. You can look up your zip code and find all of those offices in your area, or you can call their 1-800 number. And then finally, most importantly, we really encourage you to connect to our benefits enrollment centers, which is a network of centers that we fund. And with that, I'm going to turn it over to my colleague, Randy, who is going to talk a lot more about the BECs, as we call them.
Oh, thank you so much, Brandy. Hopefully everyone can hear me.
Yes.
I'm going to move over to the next slide here. And Brandy did a great job just giving an overview and a breakdown of all the core benefits that our benefit enrollment centers assist their communities with. And so just so you can see from this slide, we'll start sort of from the beginning. The benefit enrollment centers, or the BECs, are local organizations throughout the country that receive, or we call them grantees, and basically they provide screening and enrollment assistance into the core benefits which Brandy shared earlier. We have our Medicare Part D, Medicare Savings Program, MSP, Medicaid, SNAP. I noticed earlier in the survey that was sent, not many people responded to the LIHEAP, but perhaps now that we can see, it's really just home energy assistance. Perhaps that rings more of a bell with the group, as well as they connect these individuals with local benefits that they can provide in their states and in their localities. And also I see here we have veterans benefits, SSI, tax relief, housing assistance, and other services, other programs. What does the BEC model look like? So there are different models throughout the country. You have some that operate as call centers. Some are, like it's listed here, brick and mortar offices. Some are community organizations within hospitals, community groups. Some work out of senior centers. Some utilize volunteers. Some utilize case managers. They serve specific target areas and specific regions within states. However, some of them do serve entire states. As you can see here, we actually keep a map of all of our BECs. All those little colorful dots kind of give you an idea of where we have benefit enrollment centers throughout the country. The ones that have multicolors receive multiple grants from NCOA to do different work outside of benefit enrollment. And so you can see we're trying to cover as much of the map as possible and be able to provide this kind of help throughout the country. Having said, oh, by the way, back to that slide, there's a link at the top if you want to look at that map. So this slide says we have 36 benefit enrollment centers in 24 states. Well, I'm excited to announce that soon enough we'll be at 48 benefit enrollment centers serving 29 states, and this group of 12 new benefit enrollment centers begin their work, as a matter of fact, in March. And so, and I think we say that in here in the first bullet, these new benefit enrollment centers cover several areas, including San Diego, western Arizona, northern New Mexico, several cities in Ohio, New Orleans, Tennessee, Nevada, and South Carolina. Pardon my New York accent, it comes out sometimes. Since 2009, the benefit enrollment centers have helped over 650,000 low-income older adults and persons with disabilities apply for over $600 million in benefits. And it goes back to what Brandy was saying earlier, putting money back into the pot for each and every one of the individuals that they're able to help, which, when you're working on the ground, and I had the opportunity to do that at my last employer, working directly with clients, you can see the impact you have when someone's lights get turned back on, and when they're able to use their Social Security check to buy other things aside from having to pay for things like medication. And if you'd like more information on these numbers or what we're sharing, you could also see the link here at the bottom, NCOA.org /BECs, and that'll give you more information on the individual BECs, where they're located, and the types of work that they do. So you kind of have an idea of the benefit enrollment centers, but now how do we connect to them? Well, the National Council on Urban Indian Health has prepared a side-by-side chart, which was really comprehensive. It lists where the urban centers are located in each of the state where the benefit enrollment centers are. So it's kind of a bridge for them to connect with each other, and we really encourage that because we're all serving, in many cases, even from what Brandy said earlier, a lot of older adults, and so it's a good way to explore partnerships. Like it says here, make referrals between organizations, conduct outreach, share best practices in reaching Indian centers, and the truth of the matter is, like it says there, don't hesitate to contact our office to get connected with the BECs throughout the country. Some of even the new BECs and our current BECs are serving communities where there are native populations, and so it would be great for them to be able to connect with you so that when they're reaching into urban environments, they can reach these clients and these individuals and help them. So I think I breezed through that pretty quickly. We really want to invite you to join us and learn more about NCOA as a whole, as an organization. We have an e-newsletter. You can sign up for that at the very top, NCOA.org. You can follow us on social media. If you have any questions about anything we've shared today with regards to benefit enrollment centers or anything that we discussed earlier, feel free to contact Brandy or myself. But as far as the benefit enrollment centers are concerned, it pretty much covers it. And what I do on a day-to-day is try to provide technical support to all the benefit enrollment centers to make sure that they're equipped to continue serving their clients. And with that, I conclude my portion of this presentation. And I'm going to hand it back to Brandy.
Kimberly, actually.
Oh, Kimberly. There you go.
Thank you, Brandy and Randy. Definitely you just provided us with some really helpful information that's available through the National Council on Aging and could really help benefit some of the seniors and elders that our programs work with, and really just helping them to make living costs more affordable so that they, as you mentioned, they can have funds available to do other things that they might need, groceries and things like that. So definitely thank you for your time in providing all of this information to us. I did want to mention that in the download pod at the lower right-hand corner of your screen, we do have listed here the PowerPoint presentation for those that would like to download that to be able to obtain some of those links that were mentioned throughout the presentation, as well as that second downloadable file is it's a document, as Randy mentioned, it's a document that NCOA created that actually shows the linkage between the benefit enrollment centers and our urban Indian health program. So really just helping you understand which of those programs may be nearest to you in the distance from your area. And then there's also information on how you can learn more about those benefit enrollment centers through a link that's on that document. So feel free to download that at any time. That information will also be sent out after the webinar via email if you don't have an opportunity to. At this point, I would like to open it up to questions. If anyone has a question, feel free to write it into the Q&A pod, and we'll try to get those questions answered by Brandy and Randy. And actually, there is one there for you guys if you can see it.
I can see part of it. Is the question from Warren the one you're referring to?
Yes, it is.
It's cutting off for some reason. I see it says BECs in Nevada. Will they be in? And is he asking what areas will they be in?
Right. It says BECs in Nevada. Will they be in the southern or northern areas? And if you click on it, it'll actually open it up for you.
Oh, thank you. Oh, there it is. Oh, wait a minute. Okay, yeah, he says northern and southern areas. The target area for this is a new BEC that'll be starting in March. I'm just thinking back to the proposals. I believe they're going to be focused in the northern side of Nevada, but they have partners that may be able to reach into the southern part of the state. But I can always double check that for you, Warren, if you'd like.
Yeah, just to add to that, Randy, I think Reno is included in their service area, which I think I saw somebody in the chat was from.
Okay.
So that's good. Hopefully you can make that connection. We're going to be publishing the list of BECs on our website tomorrow or by the end of this week. So we'll have more information about their service area then.
Hopefully that answers Warren's question.
And also, this is Kimberly. Also, I think on the document, if they download it, it'll also show them the relations for the distance to the Nevada.
That's right.
Well.
Oh, good. Warren's happy. Happy to help you, Warren.
Great. So we have a few more questions that are listed in the participant chat box.
Okay.
Vicki is asking or stating that we have issues with clients being enrolled into United Healthcare, but the local hospitals and nursing homes will not accept this. We have contacted United Healthcare to unenroll them. They are still listed as their insurance. This is not at all helpful, as our client needs surgery and the doctor is willing to perform the surgery. But
That's a very good and serious question, and actually I'm just going to flip back the slides a little bit. This is actually a question that you would really want to contact your SHIP about. They do a lot of work to help resolve some of these issues related to claims and enrollment and making sure people aren't sort of exploited by their plan. Another organization that you would want to go to is the Medicare Right Center, which I'm typing into the chat right now, and they also do a tremendous amount of advocacy and troubleshooting for people for these types of situations.
And this is Randy, I can speak to working closely with SHIP coordinators and taking calls for intake. Even here in Virginia, we would get a lot of those specific, nuanced sort of insurance questions, and our SHIP counselors were more than prepared to connect individuals with the right folks to address those issues specifically. It wasn't like they were just handing them off. It was always a warm transfer. And so, yeah, Brandy makes a very good point.
And there's a couple more questions, if you can see them in the participant chat as well. One from Carrie.
I'm trying to.
Yeah, I'm scrolling.
Yeah.
I'll read it to you. It says, is there a point of contact for outreach events in our community? We'd love to have a representative at our national HIV/AIDS event in Baltimore.
Are you asking about point of contact for the BECs?
Or is this like are you serving older adults? Are you looking for someone within our office?
Those are good questions, and it looks like he's typing.
Either. Okay. Yeah, we actually have a lot of community organizations that we work with in Baltimore. We do a separate project on economic security issues with the Baltimore Cash Campaign and several others. If you want to give me this is Brandy, shoot me an email, and I would be happy to send me some information about the event that you're thinking about coordinating, and I'd be happy to make those connections for you.
I think she said, thanks, we'll do.
Okay, great.
We're good. Any other questions? I think that was the last one, right?
There was one being typed. I'm not sure if they had finished their question, but while we're waiting for them to write that question in, I did want to remind everyone that we do have our evaluation survey that will be sent out to you after the webinar. So if you are able to take some time out, it only takes about 2 minutes to really just provide us some feedback on how the webinar went, and if there's any future topics that you would like to have in future webinars, please let us know. So that link is on your screen, but it also is in the chat pod. At your leisure, you can take that. And then also, lastly, I'd like to inform everyone to just save the date for an upcoming webinar in March. It really is geared to our executive leadership and supervisory staff, I would say. And it's going to be really focusing in on strategies to improve customer service, specifically with frontline staff. So definitely, if you have an opportunity to go to our website, there's a registration link for that webinar already currently posted. And it looks like there was not another question to come through, but we do have a few more minutes if anyone else has any additional questions they might like to ask. I did have one question in listening to what you presented to us, and the benefitscheckup.org website. You mentioned that it provides a lot of additional information that seniors or even staff at our urban Indian health programs could access to find out what kind of benefits are out there for their seniors. But is that information being relayed by state, or is it just general information on what they would be eligible for?
That's a very good question, and it is drilled all the way down to the zip code level.
Yep.
Oh,
So the 2,000-some benefits programs that are in Benefits Checkup, the very first question you get asked is, what's your zip code? Because some of them are very, very local, transportation assistance, or, local sort of programs that are offered in your county, like county tax assistance. We've got a lot of the tax relief programs that are offered. So that's one of the benefits of using Benefits Checkup, is that we're not just sort of sending, if you're in, a county in Washington State, we're not going to tell you about something that's in Massachusetts. We're only going to give you the programs that are relevant to where your location is.
That's great. That's really important. We have one more question coming in. I'll give it a few more seconds.
Okay. I will add, too, as this question is sort of being typed in, on NCOA.org, we have a lot of handy charts and sort of fact sheets that outline the income requirements for these programs. So, for example, Extra Help and the Medicare Savings Program, we have a handy chart that you can just download and print off, and it'll easily sort of let you know what the income guidelines are and whether somebody you're working with might qualify.
I see Karen has a question from Los Angeles about SNAP. Do you see it there, Brandy?
Yeah, so Karen's asking, they're in California, have not had success trying to enroll low-income seniors on Social Security for CalFresh. You know what? You are not alone. Karen, this is issue that we hear from Californians all the time. California actually has the lowest enrollment percentage-wise of seniors in SNAP, and it has to do with the way your state administers the program, and also that any older adult or anybody in California that gets SSI, which is the supplemental security income for the kind of the poorest of the poor through Social Security, rather than being eligible for CalFresh, which is your SNAP or food stamp program's name, they get what's like known as a kind of a buy-in for SNAP. So they don't get a separate SNAP benefit enrollment. They get something kind of appended to their SSI check. And this is something that, on the national level, we've been really trying to advocate with the Food and Nutrition Service about, and sort of showing them that it's hurting a lot of people. I don't know what other suggestions to offer you on this issue. Certainly, if you're in an area with Benefits Enrollment Center, definitely connect with them to see if they've found any strategies that are working. We've got a few in California, and we're funding a few more. But this seems to be a sort of broader systemic problem in your state that unfortunately is going to require a more administrative solution.
I'm glad that Brandy brought that up. This is Randy, because we often ask the ECs to advocate for their communities, and so obviously that being such a big issue in California, that would be ripe on the agenda for the BECs that are located there.
Great, thank you. So if there aren't any additional questions, as Brandy and Randy mentioned, feel free to reach out to them at their email addresses if you have any further questions after this webinar. You will be receiving a follow-up email if you register for this webinar, which will contain those downloads of the presentation slides as well as the comparison chart for the benefit enrollment centers and then the CUI Urban Indian Health Program. So definitely keep an eye out for that email that will be coming through later on today. With that, I would definitely like to thank Brandy and Randy for your time in providing us with the information on the National Council on Aging and all of the programs and benefits that are available to our membership and to the seniors that they serve. I think this has been a very helpful webinar, and we appreciate your time.
Thank you, Kimberly. It's been a pleasure. Thank you, everyone.